Okay, this lecture is going to come from Chapter 27, the cholinergic blocking drugs. In Chapter 26, we covered the cholinergic medications. This is going to be kind of the opposite of that. So vocabulary that I want you to cue in on: anticholinergic or cholinergic blocking block the neurotransmission of the parasympathetic nervous system. If you will recall, ACH is the neurotransmitter. So that's what we're talking about here, is blocking those neurotransmissions. Also, anticholinergic or cholinergic blocking are used interchangeably, so they mean the same thing. Cycloplegia is paralysis of the ciliary muscle, resulting in the inability to focus the eye. And drug idiosyncrasy is any abnormal response that differs from the expected response following the drug administration. So, drug idiosyncrasy would be like giving Benadryl, expecting drowsiness, and instead the person becomes incredibly hyper. Mydriasis is dilation of the pupil, so the opposite of miosis. Okay, so what does it mean? So the cholinergic medications were parasympathomimetics in that they either acted like ACH or they blocked acetylcholinesterase from destroying the ACH. So the anticholinergic or cholinergic blocking meds then are parasympatholytics. So they're acting against ACH, or rather block the action on the muscarinic or nicotinic receptor sites. So you're going to get the opposite reactions. So some drugs can inhibit the nerve impulses at both receptor sites. They work to block or interrupt signals that divert blood flow to the vital organs. Blood vessels dilate, smooth muscles relax, heart rate and blood pressure are lower. So responses to cholinergic blocking drugs are variable and depend on the drug and the dose being used. So they affect the eyes, the respiratory and GI tract, the heart, and the bladder. And we'll talk specifically about in what ways. So cholinergic blocking drugs, the primary uses are to treat pylospasm and peptic ulcer, ureteral or biliary colic, so passing of stones or overactive bladder, vagal nerve stimulation, Parkinsonism, and preoperative reduction of oral secretions. We'll go through these as well, each one on how they're effective. So the adverse reaction of cholinergic blocking drugs should not be a new thing for you. I love the little picture over here on the side of the screen: hot as a hair, dry as a bone, blind as a bat, red as a beet, mad as a hatter. You will never forget the important adverse reactions if you remember that. Hot, red flush, they're dry mouth, dry skin, constipated, blind as a bat. There are visual issues, bad as a hatter, confusion. Adverse reactions are dose dependent, so larger the dose, the more intense the adverse reaction of the cholinergic blocking drugs. So for GI reactions, specifically dry mouth, they might experience nausea, vomiting, but a really big one is constipation. Central nervous system reaction is that flushing. They may actually run a fever. Remember that hot as a hair. Visual reactions with the eyes, they might have blurred vision, or there's that mydriasis. Photophobia, which is a sensitivity to light. GU reaction, urinary retention and hesitancy, so inability or difficulty in voiding. Cardiovascular reactions, they might have palpitations, decreased heart rate, or tachycardia. It can be labile depending on which medication we're talking about. For others, decreased sweat production is a big one, because remember, they're dry as a bone, and this can cause overheating. Sweating allows us to release heat and cool our body, cool our core. So they need to be very careful that they aren't in the sun for long periods of time, which can cause heat prostration. That's an important thing that you need to remember for this adverse reaction. Okay, so here's just a little thing. If this helps you remember what anticholinergics do, this is right off of the internet. It's a pretty common little meme that goes along with it. You can take it or leave it. Okay, so the cholinergic blocking drugs are going to be contraindicated in people that have a hypersensitivity or with glaucoma, because instead of the appropriate constriction and assistance there, it's going to cause a dilation because it's parasympathetic blocking. Anticholinergics are contraindicated in patients that have myasthenia gravis. Cholinergics stimulate skeletal muscles. The anticholinergics are going to block it, so it's going to make their grave muscle weakness worse. Tachyarrhythmia should not be treated with cholinergic blocking. MIs, people with congestive heart failure, that's another big one, should not take cholinergic blocking drugs. You need to remember these contraindications specifically because the risk of something really bad happening is pretty high. Use the drugs in caution in people that have BPH, urinary retention, because it's going to make them retain urine, hypertension, because it's going to cause increased blood pressure. You need to use atropine with caution in patients that have asthma. Page here, I did want to touch on the scopolamine patch. The frequency, we've talked about this before, but you want to make sure that you change that patch every 3 days. It's written right here, apply one patch 4 hours before travel every 3 days. You can switch that out. So you do want to know that. And I'm sorry for missing that. So just kind of know what these different drugs. Okay, so for your assessment prior to giving an anticholinergic, you'll want to obtain a health history, obtain their blood pressure, pulse, and respiratory rate to establish a baseline. You want to check their stool if somebody that has a peptic ulcer and watch for signs of occult blood. We want to make sure that there's no bleeding. You want to establish a baseline for their visual acuity because that's one of the things that could change, and we want to know if there's been a big change. You want to look for signs of dehydration because these medications are going to dry them out. If somebody has prolonged diarrhea, you want to make sure that you weigh the client because if we give them an anticholinergic and we stop that irritable bowel or that excessive bowel motility, we should actually see improvement or weight gain as they retain fluid. So you just want to, you're walking a fine line there since anticholinergics can have a drying effect, but in this case, if we're treating diarrhea, then we're inducing constipation for the right reason. For ongoing assessment, you want to check their vital signs, observe for all the adverse reactions that we talked about, monitor symptoms and complaints to make sure they're seeing improvement. Report any increase in severity of symptoms to the primary healthcare provider immediately. So if we don't have market improvement on a particular thing and they're on an anticholinergic, they have to report that right away. It could be that they have a significant issue going on. So basically evaluate, are things better or are they worse? If they're not getting better, and certainly if they're getting worse, report it. Expected outcomes for the patient, you can look through. This is the same, are they responding to the therapy? Are we supporting them? Do they understand compliance? For management of side effects, you want to make sure that patients realize these drugs cause drowsiness. So there's a safety issue. Make sure that before they drive or do anything like that, they know how they're going to be affected. It does cause blurred vision. And you want to note here too the possibility of photophobia. So they might be sensitive to light and they need to report any kind of disturbance in vision, whether it's blurry or they have photophobia. So if they are experiencing pupillary dilation as a result of taking this medication, because remember, it's blocking parasympathetic. So parasympathetic constricts the pupils. So cholinergic blocking is going to cause pupillary dilation. That's where the photosensitivity comes in. For some medications, it's a lot greater than others. So for like a med like belladonna, it causes incredibly large pupillary dilation. So you'd want to keep that room dimly lit for their comfort and not have bright lights, bright sunlight. It would be incredibly distressing for them. Elderly patients should be observed at very frequent intervals, especially for mental confusion and urinary retention. They are at higher risk for mental confusion with anticholinergics and urinary retention. They may not necessarily notice right away because they already have that kind of decreased need to urinate with age. Make sure that you're looking out for safety, whether it's because of blurred vision issue, a confusion issue. Make sure that you're integrating all of those fall prevention methods when someone's on an anticholinergic. So removing rugs, the throw rugs that they can trip on, moving furniture out of walkways, making sure the floors are clean and dry. Avoid waxing floors. Waxed floors tend to catch, especially the rubber soles of shoes, and trip people up and actually cause falls. Make sure you remove cords and that kind of thing from walkways. We've talked about this stuff since fundamentals, so it shouldn't be anything there. You're going to monitor the patient for xerostomia, which is dry mouth. Encourage the patient to take a few sips of water before and while taking their oral drugs and with eating meals. So they're going to be able to swallow better if they take a little sip of water and then take a bite of food. Check the oral cavity daily for sores and ulcerations when on these medications that are going to be a direct result of this dry mouth. Also, people with dry mouth tend to have like super bad breath. So even like a halitosis. So if they're experiencing this, there are some things that you can do. I do want you to look over this list of patient teaching. So frequent mouth care, brushing, rinsing, flossing. Make sure that they're not using any alcohol-based mouthwash because that's going to dry their mouth out even further. And a lot of times they have those swabs for the mouth that are like glycerin swabs. Check the ingredients on that or the makeup of that because a lot of those also have alcohol in them. So just good old-fashioned water works better than anything. Keep a glass or sports bottle of water or mug of water or something handy at all times so when they think about it, they can drink. They should take small sips of cool water throughout the day and during meals to help with swallowing. You can try flavor additives to make the water more palatable. Some people don't like drinking water, but maybe a slice of lemon or cucumber, or they even do like the strawberry infused waters. Like that's all good. It's still water. They're still going to get nice fluid intake. Take a few sips of water before taking a drug. The pills can get caught up, can cause them to choke if they have this dry mouth issue. Sucking on ice chips is a great way to keep that mouth moistened, or even popsicles. Chew gum, it says preferably sugarless just because of the issue with dentition if you chew sugary gum. You can suck on sugar-free hard candy, so that helps keep the mouth lubricated and fresh and not feeling so dry. And then I already talked about avoiding the alcohol-based mouthwashes and products. Managing side effects, constipation is a big deal. Make sure that they're drinking a minimum of 2,000 milliliters a day, even 3,000 if it's not contraindicated. They need to eat a diet high in fiber to keep that stool passing. Adequate exercise helps with bowel motility. And then the primary healthcare provider might prescribe a stool softener if they're on an anticholinergic. Now, remember, if somebody is experiencing diarrhea, then they're going to take an anticholinergic to induce, and I don't want to say constipation, but we're going to slow that bowel down significantly. So hopefully they return to a normal bowel pattern. So this is going to be more if you're taking an anticholinergic for a different reason. Constipation is a real issue, side effect. So they might use anticholinergics. Like I said, atropine drops are used to reduce secretions. The most really most of the time, what you're going to encounter is like at end of life when the individual has what they call that death rattle. And we've talked about that before, and I think even played like a video about, of how it sounds. If you recall, there's nothing wrong with that happening. The patient isn't actually suffering in any way, but it can be very disturbing to family members that are there at the bedside, and there's this horrible noise, and it sounds like they're gurgling and that kind of thing. So atropine will help dry up those mouth and throat secretions and prevents that sound. So it truly is for the comfort of patient and family. They also can be used for the same way preoperatively, especially if they're doing any kind of like a mouth or throat or esophageal type um, of a scope or surgery or something like that, just to get that extra salivation and stuff out of the way. You want to make sure that before you give any, especially this type of anticholinergic before surgery, that they void first. We don't want them retaining any urine. Make sure that they know that their mouth is going to be incredibly dry and it's normal, that they're going to be NPO for the procedure. And, when they wake up and if their gag returns and everything's good to go, that they'll be able to get a drink at that time. You want to make sure that after you give the med, this is a biggie. I would put a star here. Instruct the patient to remain in bed after they get the pre-op drug. Raise the side rails. Keep them safe. They might experience acute confusion related to the administration of the drug. We just don't know how they're going to react. They're going to be very drowsy. It might cause them to feel, lightheaded in a way that they could fall or that kind of thing. So this is definitely when you're giving this preoperatively, which tend to be larger doses or doses that might affect somebody a little bit differently, that they stay in bed and stay safe until after their surgery and after the drug's out of. Okay, atropine is also used for heart block. So essentially, the problem with heart block is it's a conduction issue. For the people that had me in clinical this week, we talked about the bunny ears showing on the telemetry monitor. And when we talk about cardiac stuff, I'll go into a little bit more detail with that. But just based on the name, heart block, you guys can guess, like, the heart isn't doing what it's supposed to be doing as far as perfusion goes. So we know anytime the heart isn't beating like it should, there's an issue. So first things first, the patient is going to be placed on telemetry. We need to be monitoring their heart rhythm. We're going to look for a change in pulse rate or rhythm, report tachycardia or any other arrhythmia, especially fatal arrhythmias like ventricular fibrillation, those kind of things. Failure of drugs to increase the heart rate must be reported to the primary healthcare provider immediately, and another drugs may need to be used to elicit the desired results. So the way atropine works for heart block or for stimulating a more effective heartbeat is because, again, we're blocking the parasympathetic system. So parasympathetic being rest and digest, when it is stimulated, it causes decreased heart rate and that kind of thing. If you give atropine, which is a cholinergic blocking med, it's going to cause the heart to beat faster, to perfuse better, and do its job more efficiently. So if atropine doesn't work, there are other drugs that we've talked about. We've talked about propranolol and different things like that, which are, propranolol is the massive cardiac stimulator or the savior type drug. And we'll talk more in depth about those when we go into more cardiac discussion. If we're using anticholinergics to treat peptic ulcers, you need to make sure that the patient has a full explanation and understanding of the treatment regimen. So because anticholinergics work to dry things out, that it works everywhere. That includes stomach acid. So it will actually work to decrease the secretion of the proton pumps that are pumping out that HCl, that hydrochloric acid, that's essentially burning a hole through the stomach lining. So anticholinergics help with peptic ulcer because it decreases the stomach acid and it allows it to begin to heal because it's not constantly irritated by acid. So you need to talk about the importance of diet. They need to avoid things like black pepper, red or hot chili pepper, or red or hot pepper, chili powder. Caffeine is huge for stimulating hydrochloric acid. They need to avoid regular and decaffeinated coffee, tea, alcohol, cocoa, chocolate, any kind of cola beverages, citrus fruits and juices because of acidity levels, fatty and fried foods, tomato products, and peppermint. So, all of those things are big offenders of heartburn and increased GI acid. I definitely want you to know what medications need to be avoided in peptic ulcer disease. Um, for the treatment of peptic ulcer, a lot of times this is where belladonna is used, which is one of the anticholinergics, and it is a big offender for blurred vision. So if that's the anticholinergic they choose, they need to report blurred vision right away. And I would write that here just so that you don't forget it. So, in educating the patient and family, make sure that they know about the adverse reactions. Teach them the hot as a hair, dry as a bone, red as a beet. It's hard to forget those things. Caution has to be observed while driving because of drowsiness, possible confusion, possible visual disturbances. List the adverse reactions that can be included in the teaching plan, along with the measures that may lessen their intensity or allow the patient to perform tasks at times when adverse reactions are least likely to occur. We talked about all the interventions. Like if you experience dry mouth, it might not be a reason to stop taking your medication for overactive bladder, but here's what you can do. You can chew ice chips, you can chew hard candy. So those kind of things. And then let them know about the serious ones that definitely have to be reported, like visual change or those types of things. Definitely confusion should be reported immediately. Evaluation is looking for therapeutic effect. We have improvement of the symptoms that we begin to take the medications to begin with. Adverse reactions are identified, reported, and managed. Oral mucous membranes remain moist. The patient complies with the drug regimen. They stick with it and take the medication as prescribed, and there's no evidence of injury. We talked about all the different safety issues that go along with these medications, whether it's at home, in the hospital, in the surgery suite. I want you to have a good understanding of how you need to keep your patient safe and what education needs to be done. Patient and family need to demonstrate an understanding of the drug regimen, and then the patient needs to verbalize importance of complying with the prescribed therapeutic regimen. So some of these side effects can be a little bit bothersome, but it may not warrant stopping the drug. And so just because like I don't like that drug, it makes me feel all hot and I'm sweating, that kind, I mean, it causes me dry mouth and I don't like the taste of food anymore. We got to help them work through some of that stuff because it might be that stopping the medication would be far more dangerous than these irritating side effects that go along with it. So we need to know what's going on with them and how to help them manage it. But they've got to report all of the side effects just in case it's one of those big ones that might warrant changing the medication or reducing the dose. All right, that's all I got.